contemporary with Alexander Fleming, there were other scientists who were following the lead that Paul Ehrlich began in the late 1800s, looking for different types of chemicals that could essentially be used as stains and also possibly be used as antimicrobials. If a chemical could bind to a cell and give it some color, it was thought that perhaps that same chemical, if applied to a living cell, might interfere with cell function. And sure enough, Gerhard Domayak was one of the chemists who was looking at different kinds of chemicals and their antimicrobial effectiveness in the late 1920s, early 1930s. Gerhard discovered a whole group of chemicals that were being used essentially as dyes and stains, and with some assistance from some French scientists, quickly realized that those same chemicals could be used to treat infection. Frontosil and sulfa became essentially synthetic drugs that could be used to essentially clear up any kind of bacterial infection. They were used successfully, especially in the early stages of World War II, for battlefield wounds. Oftentimes, soldiers were given packets of sulfa powdered antibiotic, antimicrobial, and treated open wounds on the battlefield to prevent unwanted infections on the line. Sulfa drugs now are still used, particularly for urinary tract infections. If you've ever heard of sulfamethoxyl trimethoprim or Septra, that's one of those derivatives, or a drug that's still used today to treat urinary tract infections that's derived from those old original sulfa or sulfonamide drugs. In the late 1930s, early 1940s, with the success of penicillin, derived from a mold penicillium, another group of researchers at Rutgers University, led by Selman Waksman, began looking at soil microorganisms for other kinds of antimicrobials. Particularly, Waksman and his scientists were looking at discovery of new and better antibiotics. Various kinds of soil microorganisms, particularly molds, were cultivated, materials extracted, and tested for their effectiveness to cause essentially death or inhibit growth of bacteria causing infections. Actinomycin, streptomycin, and neomycin are three of the antibiotics that Waksman and his collaborators discovered. In fact, streptomycin really was the first new antibiotic beyond penicillin at the time in the 1940s that could in fact treat tuberculosis. So prior to streptomycin, there really weren't any good effective chemical therapies to treat tuberculosis. But streptomycin really was quite the wonder drug at the time to help patients recover and get cured of their tuberculosis infection. We can create descriptive words describing different types of antimicrobial effectiveness by simply using root words that describe what class or group of microorganisms, and then using the suffix cidal, meaning killing, or static, meaning slowing down or stopping. So if we have a bactericidal antimicrobial, it's something that would kill bacteria. Bacteriostatic or bacteriostatic, simply slowing or stopping the growth. Virucidal, virustatic. Fungicidal, fungistatic. All of these are words that we can essentially create to describe what sort of effectiveness the different antimicrobials are. Antimicrobials must have various characteristics in order to be successfully used to treat infection. we're looking more specifically at antibacterial, antifungal, and antiprotozoan types of treatments. Now, each and every category of antimicrobial must have the following characteristics. They must be selectively toxic. They have to have a spectrum of activity. They need to have a specific identified mode of action. They need to have minimal side effects. And last but not least, we need to make sure that drug resistance to our antimicrobial is not easy to develop on the part of the microorganism. Antimicrobials must have selective toxicity, which simply means it kills the microorganism and not the host. Ideally, we also have a fairly wide range of therapeutic dosage before we reach a toxic dosage level. That wide range between therapeutic and toxic drug levels allows the clinicians to administer increasing dosages to essentially kill or cure an infection without killing the patient. We want to make sure we can kill the bug with the drug and not the person who's infected. Antimicrobials must have a spectrum of activity. A broad spectrum means we're going to target gram-positive and gram-negative, or a wide variety of different kinds of microorganisms. A narrow spectrum simply means that only a few species, or maybe genera, of bacteria can be affected. The mode of action. What is the target, and how does the antimicrobial affect the growth of the microorganism? Well, there are quite a few antimicrobials that are antibiotics that inhibit cell wall synthesis, like penicillins. There are some that disrupt membrane function, like bacitracin. Other kinds of antimicrobials or antibiotics will inhibit protein synthesis, like tetracycline or erythromycin. And even others will inhibit nucleic acid synthesis. Some antimicrobials will interfere with metabolism and essentially serve as competitive inhibitors, like some of the drugs used to treat urinary tract infections. And then there are some drugs that are specifically targeting viral infections, fungal infections, protozoa, and even helminthic infections. Each of those are going to have a specific mode of action for that particular group of microorganisms. Here are some examples of modes of action with cell wall synthesis inhibition, nucleic acid synthesis inhibition, cell membrane, metabolism, and even protein synthesis. All of these are various targets, and you might notice from the examples that are listed certain types of antimicrobials that you might recognize, like the bacitracin, which interferes with cell wall synthesis by altering membrane permeability of building blocks for peptidoglycan. Other antimicrobials that specifically alter cell membrane integrity so that the cell membrane literally sort of dissolves, polymyxin B. Metabolic pathway inhibitors like the sulfonamides. Nucleic acid synthesis inhibitors like the fluoroquinolones. And the protein synthesis inhibitors like erythromycin and tetracycline. All common examples of different modes of action. Here we have even more specific examples of protein synthesis inhibitors. Protein synthesis is another name or word or phrase used for translation. Translation and protein synthesis are the same mechanism inside of a cell where the cell makes new proteins. We have a whole range of different kinds of protein synthesis inhibitors, both antibiotic and antimicrobial synthetics. The macrolides, like erythromycin, chloramphenicol, and various other kinds of antimicrobials, like the lincosamides, the oxazolidinones, are all interfering with the 50S subunit of a prokaryotic cell. The streptogrammins, also interfering with the 50S prokaryotic subunit. For the 30S subunit, we have the aminoglycosides, like gentamicin, the tetracyclines, both interfering with the 30S subunit of the prokaryotic cell. Once we stop or inhibit protein synthesis, frequently depending on the target, and if all protein synthesis stops, then the cell dies.